forget, let me record the session. Just in case like people coming in or people won't be able to come in and view the lecture so that they will have a copy. Okay, so let me go back. So the reason why we do research and why we need research in community health nursing or in the nursing practice per se is because we want to provide reasons for our actions. So as I was saying, when I was in the province, yung lola ko, yung kami mga pipinsan, naglaro kami ng tri-bike, tapos nagkarera kami. Yan. So yung syempre, isang grupo na magpipinsan, so you can just imagine my cousins kasi yung tatay ko, they are 14 in the family na siblings. So, 14 sila magkakapatid. So, you can just imagine kung gaano kadami ako mga pinsan, no? So, isang grupo ng pinsan sa isang tri-bike, isang grupo ng pinsan sa kabilang tri-bike. Tapos, nagkakarera kami. Eh, yung position ko, alam mo yun, nandun ako nakasalikod ng tri-bike. Tapos, like, I was so thin back then. Those were the days. Hashtag payat days. So, I was so thin back then. And then, yung paghawak ko dun sa medyo manipis lang kasi ang dami namin nakasakay dun sa tri-bike. And we hit a stone, on the road. So, napabitaw ako. So, yun, sugat-sugat ang lola mo. And so, so may yung cousins ko, they brought me kay Lola Ima. So, Impo, yan. So, tapos, pumunta siya dun sa parang backyard. And, which is nasa bukid po kami ng time na yun. Pagbalik niya, merong dahon, and, I don't know anong dahon yun. And then, nilagay niya yun dun sa sugat ko. Yan. So, I was asking her, po, para saan po yung dahon na yan? Ano po yung dahon na yan? Sabi niya, maganda yan para sa sugat. Sabi ko, pero parang sa akin, gusto kong malaman ano yung dahon na yun. Tapos, bakit siya maganda sa sugat? Anong properties? Ano ba yun? Parang gano'n. Gusto mo naman, kahit nga yung tawag lang doon sa dahon na yun, but they don't know. They don't know the name of the leaf or the plant, and they don't know ano yung parang mechanism of action. Why is it good for wounds? And those are answered when you do research. Kasi you need to provide, hindi ka pwedeng lalo na in this, in this generation, nakatry na ba kayong kumausap ng mga generation nyo or even the younger ones? Because probably some of you are millennials, pero some are Generation Z or Gen Zers. But the ones that are younger than you, yung mga mga kapatid nyo na pinanganak from 2010 onwards, sila ang tawag natin sa kanila ay Generation Alpha. Now, this Generation Alpha that we're talking about, you have to provide reason. Sila yung mga tao na hindi mo pwedeng sabihin na basta lang. Tatanungin nila sa'yo, why? Why is it for? And then they will research that. They will Google it. And I remember one child, telling din sa dad niya, sabi ng father, ay anong gagawin ko sa'yo? Parang ganun. Parang ano ipaparusa. Alam mo yan, minsan yung mga parents natin, no, hindi, parang tinatanong nila, dahil ginawa mo yan, anong gagawin ko sa'yo? Parang anong parusa? And then sabi ng bata, Google it. Ayan. So, alam mo yun, yung mga ganong, ngayong generation to, like, we are so attached to technology and we're trying to provide reasons for our action. And that's why research is very, very important, especially now in this scheme of things. And that is also important in community health nursing. You want to provide reasons for your actions. You want to know also if what they're saying. Halimbawa, merong silang halamang gamot na pinopropose. Like, sasabihin sa'yo ng community, halimbawa, napunta ka, na-assign ka sa isang community, sabi nila, etong halaman to, maganda to para sa hindi mapaihi. It's a diuretic na plant, halimbawa. So, syempre, kung gusto mong malaman, is that even valid? So you go to research or you try it out, tingnan mo ano bang mga factors ng plants na yun, baka mamaya you will be able to like discover a plant that can dissolve stones, kidney stones. Ikaw naka-discover kasi ikaw nag-research eh. So it will be attributed sa'yo. Bibilin sa'yo yung technology na yun, yung research na yun ng ibang mga tao. So that is how you apply, research in the community setting. It applies to nursing process to care of individuals, families, aggregates, and the community. Like when you say aggregates, it's like a group of people with special needs and they're grouped together. Like teenage mothers, so these are your aggregates. Okay, so that is your introduction. So kung ganon, kung ang sinasabi natin, if meron tayong practice, that's like this one, community health nursing is a practice, what you need to do is to make standards of those practice to make to a certain quality. Bakit ba tayo naglalagay ng mga standards? The reasons why we give guidelines or standards is to make sure na may quality. Yung mga community health nurse, hindi lang natin sila inassign sa barangay tralala. Tapos, sige, bahala ka na dyan kung anong gawin mo dyan. It's up to you. Hindi po. So, we have placed certain standards that must be followed when you are a public health nurse or a community health nurse. And what are these standards? We actually adapted this from the American Nurses Association, ANA, in 2007. Okay, so let's look at that. Let me just put in next. There you go. So these are the standards of public health nursing practice in the Philippines, as adopted from your American Nurses Association, public standards of public health nursing. Okay, the first standard has something to do with assessment. Ano sinasabi dyan? The public health nurse collects comprehensive data pertinent to the health status of the population. That's one of the things that you do as a public health nurse. So in this community health nursing lecture, I can interchangeably use public health nurse or community health nurse. I'm pertaining to the same. Okay, so example are demographic data, like your gender, socioeconomic status, civil status, age. So these are demographic data. Then you have your health statistics, like, for example, do you have family history of this, or do you have this disease? So these are your health statistics, okay? So mga morbidity rates, mortality rates, and all that, all those things. Now, it's quite important for you as a public health nurse to gather this information. And you will find that it's quite easy nowadays because of technology. It's quite easy to gather such information and make sense of such information. Let me give you an example. Okay. Now, for this group, remember I asked you to go to vvox.app. Okay, can you go there now? vvox.app. So, kung meron po kayong, another device, you can use your other device, or you can split screen. So, huwag niyong i-full screen to. Ibig sabihin, may isa ka pang, mag-open ka ng Google, then sa isa side. So, i-small screen mo lang to, and then on the other side, small screen din. Then, open up your vvox.app. Yun lang. So, vvox.app. Tapos, ang makikita niyo po is this one. Let me just show you. And then, all you need to do is to type in the ID that you see right there on my screen, 152-292-577, and then join. Okay? Once you join, okay, nakalagay, Community Health Nursing, welcome. And then I'm gonna start calling. Yan. So supposed to be, you will find there an answer. What is the highest educational level of your mother? So just click there. No one will know your answer po. No one will know your answer. Just click your answer there. So it's anonymous. Diba? Go ahead.
Ma'am, ano nga po ulit yung code?
Andyan po, nasa natin. 15.
Nandun sa may taas ng screen.
Nasa taas ng screen. Right. Upper right. 152-292-577. Ulitin ko, 152-292-577. Okay, we're getting, what is the highest educational level of your mother or educational attainment ng mother? Sige. Go ahead. I'm still having like 27 pa lang na responses. Waiting for some of you. Okay. I have 30 now. 30. 32 na. So I'm gonna close the poll in 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. So now, I'm closing the poll. Chanan! Can you see now? In your screen, you will see, and in our screen also, yung pinaka-screen ng ating presentation. Oh, sorry. Ulit natin. Na-enter ko. Let me just go back. There. So you will see in the screen, okay, that, nakapin ko sa akin. Ayan. Na ang highest educational level, okay, highest educational level ng mothers, ng population natin, ng group natin, will be, like, ang pinaka-most is college. College graduates. 62.86% are college graduates. And 8.57% ang may master's and PhD. Ang nanay to, nanay mo. And then vocational, 2.86%. High school graduate study, 5.71%. But as you can see, most of your parents are educated. We can say that, like about 70 plus percent. It's like 70, this 28, 26 plus 3, that's 29. So yeah, you have there like 71% of the class, of the parents of our mothers of our class have finished college or more or higher. So that is our educational attainment. From that, okay, we can now, assess other things, baka meron pang mga correlation yan. So maybe that's the reason, or that's your influence why you entered nursing, because of the influence of your mom who is actually who's educated. So yun ang napapansin namin, no, most of our nursing students or student nurses, their parents have, a higher educational attainment than other people from other or other those people who are taking other courses. Like for nurses, most of the parents are actually educated. Okay, so let's have another. Okay, so it's that easy now. You already have your graph. You already have your results. Okay, this is another. So same lang po. Dun sa app, kung yung tanggalin yung app nyo, no? So may question yan, do you have a family history of the following diseases? Kung meron, i-click mo lang kung applicable sa'yo. May history ka ba ng diabetes? Check it. Cancer? Check it. Family history ng stroke? May na-stroke na ba sa family? May nagka-MI ba? Or may nagka-asthma ba? All you need to do is to vote, okay, for that. And then make sure that you click send. Okay, vote and then send. Kung wala, wag mo lang i-click. If it's like, for example, walang history, send ka lang. So, ibig sabihin, sa family nyo, like, you don't have history of diabetes, no history of cancer, no history of stroke, no MI, no asthma, send mo na lang. Pero kung meron, just, click it. I have 39 participants. Okay? 9 more ang hindi pa nag-respond. Make sure that you respond. It's the same app, the VBoxDat app. Okay, 10 seconds to respond. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now, from that pa lang po, no? From that, this question, do you have family history? So you can, somehow conclude that in our population, so let me just close the poll. In our population, in our sample population, wow,
Asthma.
Like 55.88% of the, like half of the population have history of asthma. Okay, 41.80. So, how will it make sense to you? Ganito lang po siya, no? When you say 55.88% ng population natin may history ng asthma, parang it doesn't like make sense, it doesn't translate. Pero pag sa community po, ang result mo to ganito, 1 out of 2. So kung dalawa kayo, yung isa sa inyo, may history yung pamilya nila na nagka-asthma. Okay? It's 1 out of 2 people. So 50%, okay, 50% may asthma history. Okay, ito naman, diabetes. You have 41%. Cancer, oh my gosh, cancer, 32%. Meaning sa atin, sa population natin, yung mga nandito ngayon sa Zoom na to at nag-respond, 32%. Ibig sabihin, 1 out of 3 or 3 out of 10. Ganon. Sa 3 out of 10 sa atin ay merong cancer history ang pamilya. And why is it important? Because you know for a fact that cancer has a genetic predisposition. So alam mo agad, so kung ang community ito, meron ka agad conclusion na halimbawa tayo yung sample, you're doing a nursing research, based on our study, 1 out of 10 of the total population of BSN2A, okay, 1 out of 10, halimbawa, or have history of myocardial infarction. Or you can have like 3 out of 10 have history of cancer. And is that high compared to other people? So yun na ngayon, pwede mo i-compare yung statistics ng community na ito sa ibang mga community. Okay? So do you now have an idea of how paano ba yun gagamitin namin yung mga health stats na yan? So this is how you use those health statistics. Do not worry, they are confidential. Yung iba baka nahihiyang magsagot. Huwag po kayong mahiya. No one will know kung ano ang kinlik mo dyan. Okay? It's just you. Ikaw lang makakaalam kung anong kinlik mo dyan. So you can be honest when you participate. Kasi may anonymity. Remember, when you do your research, it's very important for you to have to be anonymous and to respect confidentiality. Hindi mo pwedeng sabihin sa mga tao yung mga results kung kanino galing yun, no? Okay, so ito lang, pwede mo sabihin yung statistics, pero hindi mo pwedeng sabihin yung mga tao na nagsabi niya. Okay, so let's now move on. Okay. So the next standard of care that is quite important is population diagnosis and priorities. Now, it's good because in this class, you will now have your family diagnosis. Yan. So, magkakaroon kayo ng pasyente. Pero kasi ang CHN1, ang pasyente nyo pa lang, pamilya, isang pamilya. So, you'll be assessing because of the limitations that we have right now. So, probably it will be your own family. So, ang pamilya mo ang iyong ida-diagnose. So, a public health nurse analyzes the assessment data to determine the population diagnosis and priorities. Now, magkakaroon ka ng situational analysis. So, for example, ikaw yung community health nurse, nakuha mo na yung mga health statistics, no? So, halimbawa, meron kang 3 out of 10 ng mga patients mo may history of stroke. Eh, halimbawa lang, stroke. So, yun yung nakita natin. So, alam mo na mayroong genetic component, yung CVA, kaya kinukuha natin yung kanyang incidence, yung kanyang statistics. So now you can see that as a possibility for as a foreseeable crisis. So meron tayong mga tinatawag na health threat. Yung threat na yon could be something in the situation that can lead, let's say, to a disease process. So that's health threat. For a foreseeable crisis, pwede naman ito yung mga situations like in life na mapagdadaanan niya that actually can lead to a health crisis as well. So for example, pregnant yung isa sa mga family member, that can lead to a health crisis. No? So yun yung mga foreseeable crisis. So as a public health nurse, you have to know how to analyze your data. And once you know how to analyze your data, you can now think, ano bang kailangan ng community ko? Mataas ang stroke. So remember yung introduction natin ng public health nurse. You're just not looking into the stroke. Hindi mo siya pupuntahan at sasabihin na, okay, itong family nito, siguro, yung both parents namatay sa stroke. Halimbawa lang. So, hindi mo titingnan na, okay, yung anak niya ngayon, predisposed yung anak niya. So, hindi mo lang titingnan yung kanyang, let's say, blood pressure, although that's also important. But you'll just not look at that because this is public health. So, you will zoom out and look at the social determinants of health. You have to look into the patient and check ano pa bang mga, mga pangyayari sa kanya na posible mag-lead. Like, are there lifestyle choices na meron siya or behaviors na nag-lead dito sa kanyang, sa posible niyang pagkakaroon ng stroke in the future. Okay, so that's what a public health nurse does. On the third standard is outcomes identification. You have to know how to evaluate. So outcomes evaluation is you have to know you have to set your expected outcomes for a plan based on the population diagnosis and priorities. So, di ba kanina, nag-assess ka, tapos nag-diagnose ka. Ngayon naman, kailangan malaman mo, ano yung expected outcomes? Dapat may goals ka. So, you have to, have a goal as a public health nurse. Para saan yung intervention na yan? Bakit mo ako pinapatigil mag-yosi? Anong dahilan? So, because you want to reduce the risk of the patient from having the stroke kasi nga mataas yung kanyang chances of or risk of having a stroke. So that is what you do when you do your when you are a public health nurse. Moving on, planning. So unlike sa nursing care plan, usually sa clinical setup, may mga times na ang nursing care plan hindi patient focus eh. Ay may mga times ang nursing care plan nurses focus. Hindi yung lahat ng ginagawa ng nurse para dun sa patient. So for sure, gumawa na kayo ng NCT. Ayan. Sino na po sa inyo ang mga nakagawa ng NCT? Medyo magtawag ako dahil. Dutch? Dutch? Can you unmute and can I see you on screen? Sorry, kasi I like your name. Okay, it sounds like an ice cream. Like Dutch, double Dutch. Ayan. Dutch. Yeah, can I see you?
Dutch mill po. Ay.
Oo, Dutch meal. Tama. Have you ever done an NCP before? Nakagawa ka ng NCP?
Yung ano po, nursing care plan?
Yes.
Ay po ba yan?
Nakagawa ka na?
Yes po, sa ano namin, health assessment.
Okay, ano ang iyong problem?
Limot ko na ma'am, ang dami. Iba't-iba po kasi.
Kahit isang nursing diagnosis na nagawa mo na? Dami nun, ha? Kahit isa
Wait lang po. Yung ano po, halimbawa po, headache.
Okay, headache. Anong nursing diagnosis nun? So we cannot write headache, right? So what is your nursing diagnosis for headache?
Ano po, yung sa planning po? Or yung ADPI po?
Ano?
Diagnosing lang po dun po sa ADPI. ADPI.
Yeah, your diagnosis.
Ano po, wait lang yan.
Yes. What is your diagnosis?
Ano po, kailangan po ng, for example, kailangan po ipa-CT scan yung yung ulo ng patient.
Okay.
Then,
No, yung nursing diagnosis, your Nanda, Dutch. Yung Nanda, nursing diagnosis. Sige, Dutch, I'll ask somebody to help you out. Okay? Anong nursing diagnosis for headache? Anyone? Anyone from the class? What is your nursing diagnosis for headache? Just unmute and answer. Hello?
Ano po,
Yes, go ahead.
ah, parang acute headache due to stress and something ganun.
Acute headache. Are you using headache as your main your nursing diagnosis? Don't you use acute pain anymore? Headache na talaga?
Acute pain po pala.
Exactly.
Related to,
So when you
acute pain
do
related to stress.
Okay, so when you do your nursing diagnosis, you have to use nursing diagnosis. You cannot use yung diagnosis, medical diagnosis. Kasi, you have to use yung approved nursing diagnosis na nakalagay sa NANDA mo. Okay? So that's, what you do when you do that. Okay, so yeah. So when you plan out your kapag ang pasyente mo may headache, when you plan out the things that your patient has to do, or rather your patient or you're planning to do with your patient, mostly yung plan na yon is ikaw yung gagawa, right? For the patient. For example, may acute pain siya, give medication as ordered, or assess the pain intensity, like in 1 to 10, ano pong pain nyo. Yung mga ganon, di ba? So it's mostly focused on what the nurse will do. But your planning when you do your public health nursing is you're developing a plan that reflects the best practices to attain your expected outcomes. Siyempre naglagay ka ng outcome ng goal mo. Nagde-develop ka ng plan, pero you always consider the community as the principal stakeholder na sila yung kikilos. No? Action plan. Okay? Although ikaw yung facilitator, pero most likely than not, it will be an action plan wherein the patient or the community will be the one who will do the plan of action that you have actually prepared. That's the reason why when we plan as a community health nurse, it's a must that you include the community in the planning process. Kasi silang kikilos doon eh. Silang makikinabang, silang gagawa. So kapag hindi nila yon iniyayakap, so ibig sabihin, or wala silang ownership. When you plan, kapag kasama ka sa isang plano, you feel that, meron kang ownership doon sa plano. So ibig sabihin, somehow, susunod ka. It's easier na sumunod sa isang plano na kasama ka na nagplano noon. Pag hindi ka kasi kasama, parang alam mo yun, you're so hesitant to follow the instructions of the people who are conducting it. Di ba parang group work din yan? Halimbawa, group work. No? Kapag halimbawa hindi man lang tinanong yung opinion mo sa group work, parang isa lang yung nagdidesisyon, parang in your heart of hearts, parang ayoko tuloy mag-participate, bahala kayo na lang mag-report, ganon. Kasi feeling mo wala kang ownership doon sa pagpaplano. So ganun din sa atin in community health nursing, it's super duper important for you to include the community because they are your stakeholder. Buti na lang malakas yung boses ko. Pero wala nagsabi sa akin, hindi nakakabit yung headset ko. Ngayon ko lang siya nakabit ng maayos. So, I hope that you hear me clearly. Did you hear me clearly on the earlier parts? Narinig niyo naman ako?
Yes, ma'am.
Okay, kasi ang gumagana
Yes, ma'am.
lang yung computer audio kanina. Kaya sabi ko, wait lang, bakit ganon? Now it's clearer. Okay. So anyway, so this is your planning. The fifth standard, okay, let's continue, is implementation. Pinlano mo, i-implement mo na. Okay. So, ang mahirap daw sa atin in the Philippines, like we're good with planning, but in the implementation, dun tayo nagmimintis. Kasi ang dami nating mga batas and they are very well-written laws. And yet, in terms of implementing these laws, dun na tayo nagkakaroon ng problema. Unlike other countries, which, probably Asian countries also na mas progressive sa atin, magaling sila sa implementation ng mga laws nila. Kaya nga pag pumunta ka doon, ikaw mismo matatakot kang labagin yung mga batas nila. For example, if you have ever been to Singapore, they have this, very strict laws on littering. Ayan. Kapag ikaw, wag ka magtatapon ng basura, wag mong dalhin yung mga Filipino style mo doon na kahit saan-saan ka nagtatapon. Nako, doon very strict sila dyan. Aside from multa, minsan may community service pa. So the people who are going there, they're so they follow the laws because the laws are implemented very strictly. Okay? So, doon papasok yung implementation natin. So, implementation. So, the public health nurse implements the identified plan by partnering with others. So, part of the implementation is your collaboration with other people. You coordinate with the people. You look at the plan or you evaluate during the implementation of the plan, no? So, yan po yung ginagawa natin sa community health nurse. Okay, so you could go back to the Vivox app, okay? And this is the question. Who can you collaborate with when planning for a community health program? Sino sa tingin nyo yung pwede nyong makasama when nagpaplano ka for a community health program? Mag-i-implement ka ng community health program. You just type in your response and then enter. Sinong pwede mong maka-partner? Okay, you can enter as many as you can think of. Who are these people who you can partner with when you're planning, let's say, a community health program? Sabihin natin, halimbawa, meron kang program na, breastfeeding campaign. Meron kang breastfeeding campaign. Sino-sino yung mga pwede mong maging partners with that? Sino pwedeng tumulong sa'yo? Mag-collaborate ka with? Okay. Just enter the text and then send. Okay, so I'm getting responses already. Okay. So based on that, let us check. Yay! Ito yung pinakamarami. So the larger
Si Alex.
the larger your the word, it means mas marami nagsabi nun. So some of you barangay officials, napansin nyo na you need to write the text as one word. Ayan. So, ayan. Barangay captain, DOH, guest speaker, good. Families, yes. Health professionals, barangay health workers. Okay. Alex? Sino si Alex? Bakit yung naging partner si Alex? Tao to BHWs, good. Nurses, NGO, pregnant mothers. Correct. Kung you're planning to do a community health, program targeting them, dapat kasama sila sa collaboration. Classmates? June. Yan. Sinong mga naglagay niyan? Okay? Hindi ko malalaman. Derek. Ayan. Pregnant. Neighbors. Zantua. Sino to? Ayan. Isang tao lang to kasi pare-pareho yung kulay eh. Okay, so when you talk about collaboration, it's very, very important that you tap the people who are actually capable of helping you out. Okay, so that is very important. Okay. So let's now go to your implementation. So yes, of course, you have to coordinate. You have to have a health education and health promotion portion of your program. And then you have your consultation. So let's say may guest speaker ka, so part of that will be your consult or your doctor is there. And so you have regulatory activities, which means that you include also activities that will evaluate the implementation process as it is going or as it is going on. For example, ang naisip mong health what do you call, health program is, let's say, yung activity ng mga senior citizen like Zumba, ayan, Zumba something, yan. Oplan Balik Alindog. Narinig ko lang to sa mga sa mga Facebook post. So halimbawa ganon, yun yung yun yung plan mo. So you have that Zumba exercise. As you are doing or implementing it, meron kang mga mapapansin na mga parang needs for improvement. And those are the things that you can institute on the next session. Let's say I'll choose a different venue, baka hindi yun conducive, baka may parang may slippery area, or pag umulan hindi siya conducive, so mga ganon. So you do the evaluation as the program is being implemented on, and then next you have your evaluation. So aside from doing the evaluation as the program is happening, so the public health nurse also evaluates the health status of the population. That's the reason why we have what we call your health statistics. So eventually when we go to epidemiology, pag-uusapan natin yan. Yeah, I'm so excited for epidemiology. Yung mga magagaling sa math, yay! So hindi ka magaling sa math, yan, kasi may formula yan, and then you need to, calculators, and you need to compute. Yeah, so that is an experience. Okay, so this is another type of an indicator, a health indicator. So this is a question, so please answer yes or no. Have you ever experienced depression or extreme loneliness during the pandemic? Yes or no? Remember, no one will, know your answer, so you could be honest. Have you ever experienced depression or extreme loneliness during the pandemic? Okay, I have 40 participants. Yes or no? And based on that, here are your statistics. 58.97% answered yes, and 41% answered no. So can you imagine now the importance? Meron ka ng basis kung ba't mo sasabihin na napaka-importante ng mental health para sa program na gagawin mo sa iyong mga participants, because it's like 58% more than, it's like 6 out of 10 people experience depression during the pandemic or extreme loneliness. Let's have another question. You can just be honest about this. Have you ever had suicidal ideations or attempted suicide in your life? Have you ever had suicidal ideations or attempted suicide in your life? Don't be afraid. We have no way of knowing your answers if you're shy. Let's go to the statistics. And the answer is 48.65%. Kung 40 tayo dito, 20 sa atin. It's like 50%. 20 sa atin nagkaroon na ng suicidal ideations or nagtry na mag-suicide sa buhay nila. I mean, once in their life, or for some, probably more than once. Why, why am I asking these questions? Because these questions gives us now the basis, like for you guys, you probably see your schoolmates here right now, or your group mate sa online, smiling, kidding, ganyan naman ang mga may suicidal attempts, sometimes they laugh the hardest, and yet when they're alone, there goes their ideations. Ayun, andun na yung mga idea that there's no hope. So why is this such a bother for me personally? Nakita ko like 50% of you guys have decided at one point in their life that parang, there's no meaning, there's no point in going on. And if I see that in this group of people, kayo yon, and how can I do something about that? So sa akin parang, wow, sobrang laki ng stats. This is such a huge statistic. Hindi ko in-expect. Akala ko nga, like mga 2%. But this is such a shock for me to know that so many people are hurting. It's like if you are the one who answered no, probably the person beside you or the person on the other screen, near you, actually said yes. And sometimes we go through life like not knowing this. And this is so important, If you have, tried this or felt this or thought of this, like this is so important because it always begins in the mind. The commission of the action sa utak nag-uumpisa. And if, I would just like to post this, I would like to grab this opportunity kasi nakikinig naman kayo sa akin. If any of you, for any reason, at any point in time, like, middle of the night, madaling araw, have experienced, or having these thoughts, you can call me sa messenger or whatever. I'm just giving it out there. Let's talk about this. Please for someone with experience in suicide, it's a little bit selfish, because there are people that you will leave behind who love you. Sobrang nagmamahal sa inyo. So, if you commit this, make sure that you exhausted all your resources, even if isipin nyo siya, just, look up your phone book and look at the people on those phone book and try to contact them. Maybe one of them will be there to listen kung ano nangyayari sa'yo internally or in your mind. Okay, so I would just like to put it out there. Okay, so because this is quite serious, as a community health nurse, you will soon, if you will become, if this is one of your career path, you will hear people, happy people, seemingly happy, seemingly successful, seemingly accomplished people taking their own lives. And it will be such a shock. Pero kasi it seems that there are no signs. There are no symptoms why they did that. It's like, it's illogical for you. Bakit ganon? Ba't nila ginawa yan? But that is the reality. So part of that is offering yourself to others. So let me just put in my number. 4458. Here in the chat box. So you can contact me anytime for any needs, especially that has something to do with your mental health. Okay, so we can talk about it. Okay, so that is an example of a mental health statistic. Isipin nyo, ano lang tayo, it's a live poll, you know? And you can get so much data with a live poll. It's like, 50% of my student nurses in section B have experienced or tried, suicide in their life. And that's, to me, it's such a shocking statistics. Okay, standard 7 will be quality of practice. When we talk about quality of practice, it means that as a public health nurse, hindi tayo basta putyo-putyo lang. Alam mo yung putyo-putyo, yung pacham. Yung pachamba-chamba ka lang, putyo-putyo yung gawaan mo kasi government naman to, maliit lang sweldo ko. No. Usually, if you really want to embrace nursing as a vocation, not just a profession, and you want to embrace community health nursing or public health nursing for that matter, you are not doing it for the money. Okay? Yun lang masasabi ko. Kung kayo po ay hindi lilipad abroad at magsistay kayo dito sa Pinas at magiging public health nurse kayo, it just tells me one thing, you are not doing it for the money. Because if you're doing it for the money, then you are going abroad and probably taking care of the Caucasians, you know? So, alam natin yon, mga puti, or mga Japanese or kung sino man, mga German, yan. Yan ang mga pag-aalagaan mo. Europeans, yan ang mga aalagaan mo. But if you're doing this for public service, for the love of the Filipino people, then you will do it here at home. And if you're doing it here at home, you have to make sure that you elevate our profession. Alam mo yun, mga complaints, yung nurse, walang alam, yung nurse, assistant lang ng doktor. But, kung magugulat kayo, no? I have some of my students majored in public health. So sila ay mga public health nurses, sorry. For a while. They are public health nurses, not just here. And ewan ko kung naalala niyo yung RN Hills. Yung mga nurses, yung dinideploy sila kung saan-saang lugar. May batas na yun RN Hills. So, yung mga kahit fresh grad yung iba, dinideploy sila. So, meron ako mga estudyante before sa review na deploy sila sa Mindanao. At grabe yung experience nila doon nung nagkaroon ng gera. Yung mga pasyente daw nila papasok sa rural health to, guys. Imagine, rural health. This is not a hospital. This is not a hospital. It's like primary health care ang ino-offer nito. Wala tong surgeon, walang ganun. Pero papasok daw sa rural health, dun sa RHU nila, yung mga nasabugan ng mine, alam mo yun, or granada. Meron daw isang soldier pumasok sa RHU nila, dala-dala niya yung isa niyang kamay o paa, ganun. Parang, alam mo yun, tas yung isa naman, kapit-kapit niya yung, yung intestines. Kasi may wakwak dito yung, wakwak na yung, skin niya. So, yung mga intestines niya lumalabas. So, hawak-hawak niyang ganyan, kapit-kapit niya. And sabi niya sa amin, grabe. Tas yung mga doktor na naka-duty dun sa kanila, as in, wala silang idea anong gagawin. Parang, shock din sila. Kasi hindi naman sila surgeon at it's a public health nurse, a public health community RHU unit. And then minsan walang doktor. So sabi ko, anong ginagawa niyo doon? Anong ginagawa niyo? Paano yung primary lang po, ma'am. Wala po kami rin po magawa. So they will try to stop the bleeding. They will, alam mo yon, try to put on some sterile gauze para for matransport nila sa totoong ospital, alam mo yon. So and these are the people who are saying that we are trying to elevate the quality of public health nurse, ma'am. Kasi po talagang wala pong supplies. And how can you have those supplies? How can you And ipapasok ka dun sa mga pag-collaborate mo, pag-tie up mo with your community. And making sure that as a public health nurse, you enhance your own skill. As in, alam mo yon, enhance your own skill. Huwag ka lang mag-stay put dyan, enhance your own skill. That's why we will go to education. Another standard of practice of the profession will be that public health nurses attain knowledge and competency that reflects current nursing practice. Pasok dyan, continuing education. Wag po kayong maging masaya lang na matapos kayo dito sa college and maging RN. Take it a little step higher. Do your master's degree. Do your majors. And then after that, maybe a PhD. I don't know about you, but take that training to a higher level. Maraming RNs. Pero, how can you be like separated from them is if you take that a little bit more, a step higher. Okay, so that is for education. I would like to give to you, I think it's Albert Einstein who said that learning begins when at birth and commence only in death. So, ibig sabihin, you're a learner forever. As an educator, sa amin, it's a must that we do continuing education. We keep up to date. Ano bang pinag-uusapan ngayon sa nursing field? Ngayon, ang pinakauso po is geriatric nursing. So, yan ang mini-major ng mga tao because they have this vision that the Philippines is going to the geriatric Philippines. So, nag-age na daw ang Pilipinas. And because of that, darating yung time na magkakaroon na daw tayo ng mga nursing homes na mga talagang magiging focus ng nursing care. Kasi kung mapapansin nyo, usually ang mga nursing homes natin, yung mga home for the aged, mga government owned or operated. Pero darating daw yung time that there will be a private owned geriatric nursing homes na magpuput up and yun, kakailanganin nila ng mga geriatric nurses. So, that is what is being talked about in the profession right now. So, dapat ikaw updated ka rin dun sa knowledge na yun, no? And then you have your professional practice evaluation. The public health nurse evaluate one's own nursing practice in relation to professional standards. Sobrang importante that you do your self-evaluation when you are a nurse. Kahit pa hindi PHN, kahit anong step of the way, you do self-evaluation because only people who evaluate. Have you ever heard of the cliche that states, or the quote that states, experience is the best teacher? Narinig nyo na ba yun? Experience is the best teacher. Have you ever heard that before? Okay, so
Yes po.
Okay, Nicole, thank you. Ayan, so if you've heard that before, and you probably agree with that, pero that quotation misses a very important word. Kasi experience can only be the best teacher if it's evaluated. So, dapat evaluated experience is the best teacher. Bakit? Bakit may mga ibang tao, they commit the same mistakes over and over again? May mga kilala kayong ganon? Halimbawa, sinabihan mo na, may friend ka, no? May friend, niloko niya ako. Ganon siya sa'yo. Tapos sabi mo kasi naman di ba sabi ko sa'yo, manluloko yun? Babaero yun? Bad boy yun? Tapos sabi mo, tapos magugulat ka naman next month, ibang bad boy na naman yung pinili niya. So parang iniisip mo, ano ba to? Hindi na talaga to natututo. Kasi hindi niya ini-evaluate yung past experience niya. So hindi lang experience. You have to evaluate your experience for you to be able to learn from it. I've heard of a quote that says, an intelligent person learns from his own mistakes, but a wise person learns from the mistakes of others. Hindi mo na kailangan pang makommit yung same mistake na nakakommit na ng ibang tao. Kasi nakita mo naman yung problem nila. For example, halimbawa, sinabi social distancing, sabi mag-face mask saka mag-face shield, sabi wag muna mag-inuman. Alam mo yon? Kailangan mo pa bang try ko nga mahahawa ako ng COVID dito, makapag-inuman kaya ako? Hindi mo na kailangan yon, no? Kasi from the experience of others pa lang, na na-experience nilang mahawa ng COVID dahil sa hindi nila pagmamask or pakikipag-inuman sa kanto, alam mo na agad, kaya hindi mo nagagawin. So that's a wise person. Okay, so you have to evaluate. So let's evaluate ourselves. Okay, go to your VVox app again. And this is the question. How much effort are you giving as a student nurse? You have to be honest. Gaano kadaming effort yung totoong binibigay mo ngayon, ha? Bilang estudyante. Okay, is it 25% of your total, or 50%, 75%, 100%? Yan. Kumbaga si Taguro. Ay, so, alam ko medyo mas bata kayo sa akin. So, hindi niyo pa kilala si Taguro. Pero kung kilala niyo si Taguro, ilang porsyento na ang binibigay mo as a student nurse? Okay. Sa pag-aaral, yan. Are you giving it your all? Okay. Be honest. Okay, I need to be honest as well. So ako, nilagay ko din yung kung gaano yung percent ko nung estudyante ako. Okay, let us look at the answer to this poll. 50% gives 75%. 31% gives only 50%. And 7.89% of you gives only 25%. At only 10% gives their 100%. What does that mean? What does it say about us? So ako talaga, to be honest with you, when I was a student nurse, I only gave 50%. Kasi nung ako estudyante po, sobrang addict po ako sa novels. Like, sa library, ang library namin sa SLU dati, nasa 7th floor. 7th floor siya. Tapos, as SLU po sa Baguio, wala pong escalator, walang elevator. So, you have to climb up sa 7th floor. At lagi nyo ako makikita doon sa library sa 7th floor kasi nandun yung section for novels. Like, yung mga fiction, ganyan. Sobrang addict ako. As in, bumibili yung school namin, let's say, for example, Harry Potter. Pack. Ayan. So, meron kami lagi nun. Unahan yon. So, pag nakabili sila nun, paglagay sa shelf nun. Ayan. Pag tinignan mo yung, di ba meron yung parang list ng mga humiram. Ayan. Kung lagi mo ako makikita dun sa first mga 3 people na humiram ng bagong labas na libro. Kahit ano pang libro yan nung lumabas, yan, andun ako. And I remember that so vividly. So, I only give like 50%. So, I don't read mga textbook. I read mga novels. So, kayo din. Many of you answered, you give less than 50% sa pag-aaral nyo ngayon. No, I think if I compute this correctly, it's like 40% of you give even less than 50%. Anong ibig sabihin noon? It only says na kaya hindi siguro ganun din ka-profitable sa'yo yung nursing. Kaya wag ka magreklamo kung bakit grabe wala akong natututunan. Kasi ikaw mismo, as a student, you're not giving your all. You're not giving your 100%. And many of you are, giving their 75%. 50% of you are giving 75%. So like, you're still not your best. Kasi syempre, our best is always 100%. And when we give that, we gain a lot. So ako, ang isang laging sinasabi sa amin nung favorite kong teacher sa nursing, lagi niyang sinasabi sa akin na mag-aral ka, mula first year sinasabi na sa amin, mag-aral kayo as if you're reviewing for the board exam. Kasi yung iba parang, pretty, parang, go with the flow, bare minimum, yan, pwede na yan, ganon. So, when they take the board exam, before they take the board exam, doon sila nasa-stress. I recall, I did not review for the board exam. Hindi ako pumasok sa review center kasi we don't have the money. And naalala ko yung time na yon, yung mga classmates ko na pumasok sa review center, nang hihingi ako ng photocopy nung mga questionnaire. Alam mo yung may question, tapos may answer ng mga 500 items, gano'n. Yun lang. Sabi ko lang, pwede naman ako ng copy. Bawal magpa-photocopy. Yun ang rule nung nila review center. So, kinokopya ko yun. Yun lang ginawa ko. Pero, I did not, review sa review center. Kasi, somehow, I was like, para namang may natutunan na rin ako dun sa nursing. Because, when I was, when I was in class, I tried to absorb everything that I can. So, sabi ni Confucius, when the student is ready, the master appears. It doesn't matter if the teacher is like worse. Some of you probably have your favorite teachers right now. And ako, when I was a student, I also have my favorite teacher. Pero, it's still possible na kahit na yan yung worst teacher ever ng iyong, may matututunan ka pa rin. Kasi pwede ka naman mag-self-study, no? Pwede ka naman magbasa ng book. Kung may textbook siya, basahin mo na. May mga teacher din naman ako na ayaw ko dati. So, ang ginagawa ko, binabasa ko na lang yung textbook kasi minsan pag in-explain ng teacher ko, mas nalilito ko. May ganun, no? Pag in-explain niya, parang mas nalito ko. So, ang gagawin ko, basahin ko na nga lang itong textbook. So, ganon. So, that's what I do before. Okay, so I hope that you do your self-reflection. Kaya ako ito pinagawa, ito, is para mag-reflect ka. Oo nga, ano nga bang effort ko ngayon sa nursing? So, put in a little more effort. So, kung 25% ka, lalo na yung mga naglagay ng 25% lang yung effort, ha, guys. Come on. Level it up, okay? Kumbaga kay Taguro, yan, taas-taasan yung porsyento, okay? Okay, next is standard 10, collegiality and professional relationships. Now, uso sa mga communities yung competition, no? Parang sino mas magandang project, sino mga ganon. Pero isang pinaka-importante na sometimes na may miss out is you have to have like professional networks when you are a community health nurse. So public health nurse establishes collegial partnerships or professional networks while interacting with representatives of the population for professional growth. So you associate with other RHUs, you look at them, anong mga ginagawa nila, baka may best practices sila na pwede mong ma-adapt sa community mo. Kasi may mga times na hindi mo, for example, di mo, ang ganda ng idea na yun parang, tatanungin mo siya, ma'am, can I collaborate with you? How did you implement that in your community? Kasi gusto ko pong i-adapt yun sa community ko. So it's necessary for you to establish professional networks. Ganon din po for any of you who are thinking of entrepreneurial nursing. So you need to establish networks. They are super duper important. Okay, next is your collaboration. For collaboration, so para naman to usually sa mga health programs mo, like your population itself. The public health nurse collaborates with representatives of the population in health promotion. So like inter-barangay projects, yan. So part yan, no? So, may naalala ako sa inter-barangay. Okay, so I know that you're preview to the news of a barangay captain who was caught on Zoom doing something. Okay, nasty. Okay, so please make sure that when you do, kasi ano yon, kung ba't ko nabanggit, kasi inter-barangay pala yon, guys. So I was like looking at the news. So it's like an inter-barangay project against COVID, parang ganon. So, and yet they were like, ayan, so they were caught. Okay. Anyway, so that is your collaboration. It's very important. Ethics, yun. Yung moral fiber. Very important, a moral fiber. So the public health nurse integrates ethics in all areas of practice. So as a PHN, sometimes you will be, you know your ethics, no? Di ba, naalala niyo pa ba yung mga ethical principles? Beneficence, non-maleficence, you have your justice, you have your autonomy. Okay, so all of these ethical principles should be upheld with public health nursing practice. Okay, what about research? So kanina lang, no, ginawa natin. Marami sa inyo natakot nung nabanggit ko yung research. Nagagawa tayo ng research dito sa community. So parang sabi nila, research, parang takot kayo sa research. Huwag po kayo matakot because research, as I've told you earlier on the first slide, na it's very important because it gives you a why, a rationale, or a reason for your practice. So that's why we utilize the research findings in our practice. So it's also important that we do research in the community. Like kahit yung simpleng health statistics, that is a research. Kasi inaalam mo eh. So pwede mong kunin yung mga health statistics. So ano ba ang reason? May tanong ka, anong reason kung bakit sa barangay natin mas marami, let's say for example, mas marami ang ang obese. Yun na lang. Mas maraming obese kesa sa ibang barangay dito sa, let's say, dito sa Calamba. Bakit mas marami? So you have to one of the things that research will answer is baka may mga factors that actually affect the obesity in your barangay. Baka sa barangay nyo, halimbawa, wala kayong park. Baka may factor yon na, kasi hindi naglalakad na yung mga tao kasi walang park, halimbawa. Or baka naman ang reason is napakalapit nyo sa fast foods. Ayan, so yung mga tao puro pag-grab-grab na lang, ganyan. So, alam mo yun, what is the reason behind, ba't ang taas ng obesity rate sa barangay ninyo kesa sa ibang mga barangay sa Calamba? Halimbawa lang. So, that is an example of a research question. Okay. Next, and number 14 is research utilization population. Ang ibig lang pong sabihin yan that the public health nurse considers factors related to safety, effectiveness, cost, impact on practice in planning public health programs. Hindi ka basta-basta mag-create ng health program na hindi mo kinoconsider kung ano bang resources ng community natin. Halimbawa, magpa-health program ka, okay. So, ang health program natin is exercise. Halimbawa lang, o free Zumba. Una, wala kayong park. Wala kayong basketball court. Halimbawa lang, no? Pero lahat yata may basketball court. Pero halimbawa, wala kayong sariling basketball court. O meron na kayong basketball court, hindi siya covered court. Paano pag umulan? So you have to always consider the resources that you have, the barangay has, kung kaya ba yung health program na yon. Kasi baka mag-planning ka, pero hindi rin siya magiging successful kasi hindi mo kinonsider yung effectiveness, hindi mo kinonsider yung cost, hindi mo kinonsider yung feasibility ng programa mo. Okay, so program should impact the population as much as you can. And the last is leadership. The last standard of practice is leadership. The public health nurse provides leadership in nursing and public health, which is, very important also. Now, I have a question for you. It's a simple research question. Okay? So remember the nabanggit natin dun sa unang lecture about the determinants of health. So para sa'yo, personal to, which of the following determinants of health has the highest impact on your decision to avail health services? Alin dito yung pinaka-importante sa'yo bago mo i-avail ang health services na binibigay ng community nyo? Halimbawa yung barangay. Is it effectiveness of the health service? Cost? Is it knowledge about the health service, yung information dissemination? Accessibility or convenience para sa'yo? Promotion or reward for availing? Baka naman pagka nag-avail ka nun, meron kang, let's say, free half kaban ng bigas. Yung mga ganon. So, what is highest impact to you when you consider this? Ito ako. Okay, make sure that you answer the poll. Yan, I have 35 participants. Okay. I-weigh mo, ano yung number 1? Ayan. Reason kung bakit mo i-avail ang health service. Cost ba? Kasi libre, halimbawa. Ayan. Is it effectiveness? Kasi siya talagang proven sa research na gumagana. Yung kaalaman mo doon? Okay. Ayan, nakaboto na lahat. Let's see now. Oh, many of you answered effectiveness. So 50% actually considers effectiveness as the highest reason why they will avail the health service. So kung ibig sabihin, kung na-prove ng barangay, parang sinasabi, para sa inyo, para sa community natin, bawa community itong N2B, bawa community tayo, para sa community natin, ang pinaka-importante, effective yung mga health service na ino-offer. So kailangan ma-prove ng community health nurse na yung health service na yon ay effective para yung mga tao ay mag-join. ako ang answer ko dito, nandun ako sa second highest. Okay, ang answer ko dito is accessibility or convenience. Siyempre, tamad ako. Kung yung health service yan, hindi, kailangan ko pa mag-tricycle para mapuntahan, hindi ko yan pupuntahan. So, gusto ko accessible siya. Andiyan lang, nakikita ko pagdaan ko dun sa gate ng subdivision natin, ayan, nandyan na siya. Ganon. O kaya walang pila. Alam mo yan? Pag may pila, ayoko na. So, that is also a consideration. Do you see this? Kung bakit to importante for you, this answer to that question, because it will now help you in planning out the health services that you will offer. Kailangan convenient, kailangan effective, kailangan distributed yung knowledge appropriately. Tapos yung cost, tinan mo, ba, mga RK, hindi number 1 ang cost. Pero sa ibang community, yan ang number 1. Kailangan libre. Pag di libre, walang sasali. Yung mga ganon, no? So, minsan ganon. So, and then you have your promotion. So this community, yung community natin ngayon ng mga bumoto, hindi importante ang rewards. Wow. Okay lang, hindi masyadong importante kahit walang reward na free ka ba, 1 ka ba ng rice, okay lang, sasali pa rin sila as long as effective yung health service. So you see, so parang ang community pala natin, hindi na natin kailangan i-bribe pa. Na for example, uy, ako na yung pinaka-best teacher nyo kasi bribe ko kayo ng mataas na grades. Taray. Okay. So ibig sabihin your population is not like that. Okay, so this is an example of when you evaluate your or before you plan out, you evaluate your situation or you analyze your population. Yay! And this is now for our activity. I'm so excited. Okay. For your activity, which you can see in this last page. So if you are with me right now, you can take a screenshot of that. Okay, pa-screenshot na lang po. So this is activity, conduct a virtual interview, taray, of 3 people who have availed of your barangay's health services this year. So ang dami namang ino-offer ng barangay health service kahit before the pandemic pa. Halimbawa, may kilala kayo nagpe-prenatal o kaya naman nagpunta para doon sa vaccination o kaya naman meron kayong alam na nagpa-TB dots, basta ganon. Just look for 3 people, interview 3 people who have availed of your barangay's health services this year. And then number 1, get their demographic data. Age nila, sex, educational attainment, occupation, civil status. And then ask them what services they availed. So is it TB dots? Is it prenatal checkup? Is it vaccination or immunization for the children? Is it, ano pa mga ino-offer ng mga health? Depende kasi, meron pang adolescent health, meron pa mga, mga genetic counseling, basta kung ano man po yung in-avail nila, just write it down. And then number 3, you have to do it in scale. So in a scale of 1 to 5, are they satisfied with the following? So level of satisfaction kinukuha natin. Health worker, 1 to 5. So 1 being least satisfied and 5 being most satisfied. So ang middle, so parang, alam mo yun, not, parang satisfactory lang. Or no, average, parang ganon. Hindi sila satisfied, hindi rin sila super satisfied. So nasa gitna lang. So it's Likert scale siya. And then you're gauging the health workers' competence and attitude, venue, the procedure itself, cost, kung may bayad man, is it satisfactory? 5 pag very satisfactory. Syempre pag libre, very satisfactory. Then overall health service, yung in the entire thing, totality of that, what is the scale? And then number 4, what does the health workers need to improve on? Or what do the health workers need to improve on? So meron ba silang kailangang i-improve? So kailangan, halimbawa, ma'am, yung venue po, ang init, halimbawa, or mahaba yung pila. The procedure itself, walang organization. So isusulat nila yon. Please make sure that you're really interviewing 3 people from your barangay and not just make stuff up, you need to really interview 3 people And para ma-sure that you really interviewed 3 people, I want you to take a screenshot of your interview. Okay? So, di ba, halimbawa, nag-interview ka via Zoom o kaya via Messenger, screenshot lang nung interview. Tapos, nakatakip na lang yung eyes nung ini-interview para sa anonymity. Okay? So, wala siyang pangalan. Nakatakip din yung pangalan. Pero, kailangan may screenshot nung pinaka-interview para alam ko talaga nag-usap kayo. Okay? So, 3 tao. Okay? And then you will submit it in your Google Classroom. I'm gonna post there this activity also, pati yung mga ano niya, and I'm gonna give you the form that you will fill up with the details that you will be getting. Okay? So, any questions? And that is the end of our lecture. Yes. Somebody?
Ma'am, what if wala pong nagiging programs sa barangay?
Walang program ever? Kahit pa Zumba or
Wala.
something?
Wala po talaga, ma'am.
Saan ka nakatira? Sino yun?
Lawa po.
Lawa?
Patay, susumbong na ni ma'am sa City Hall.
Barangay Lawa po.
Barangay
Ma'am,
Lawa? Wala kayong program? O sige, kahit sa ibang barangay.
Ma'am, pwede po ba yung parang picture na lang po yung ka-interview?
Sorry, pipicture mo yung ka-interview mo? Okay lang, basta takpan mo lang yung mata niya.
Yung nanay ko po kasi interview ko.
Oo. Ba mo sinabi? Pwede
Ay,
nyo
ma'am.
palang kamag-anak. Okay lang. Pwede nyo palang kamag-anak, guys. Kasi baka may kamag-anak naman kayo na nagpa-consult sa barangay. Or,
Pwede naman po kami anak.
pwede. Takpan nyo na lang yung eyes para hindi na makilala.
Kahit yung ka-interview ko na lang po yung picturean ko.
Hindi ka kasama sa
Oo,
Hindi
pwede naman.
Okay lang. Kasi
Sige
yun yung way ko lang para malaman na talagang nag-interview kayo. Kasi syempre, ang dali na mag-imbento. Gusto natin talaga i-assess yung level of satisfaction ng mga tao dun sa barangay programs ng health. Yes? Cleo?
Okay po, ma'am.
Okay. Who's asking a question?
Ma'am, ano po,
Go
kailangan po talaga virtual interview. Kunwari po may kakilala ko dito sa street namin, ganun po.
Pwede namang hindi virtual. Kasi kaya ako nilagay na virtual, baka yung iba, let me just close my sharing. Ayan, stop share ko lang. Ayan, para makita ko kayo. Okay, so ang problem kasi yung iba, bawal lumabas sa kanilang bahay. So, especially those under 21. Okay, so kaya virtual interview. Pwede naman, pero kung may kakilala kayo within the community, like barang kapitbahay or pwede naman yung picture ay selfie. Pwedeng selfie. I-black out nyo lang yung kanilang eyes so that they will not be identified.
Ma'am, ano po yun? Kahit po, limbawa, picture po, ganon. Tapos, yung mga isasagot po niya dun sa tanong, kahit isulat na lang din po, tapos pipicturean, ganon.
Hindi.
Or kailangan po video.
Hindi kayo gagawin ng video. Ano lang, di ba, kaya ko sabi virtual, kasi di ba nag-video chat yon, so screenshot. Hindi nyo
Okay po.
hindi nyo i-record yung interview nyo. Yung information, halimbawa, nag-interview ka, yung information, kukunin mo lang yun talaga sa notebook mo dun habang nag-interview ka. Tapos, ilalagay nyo yun sa Google Form. Meron akong form na ilalagay sa Google Classroom natin, tapos i-input nyo lang dun yun. Gets?
Apa, ma'am. Thank you po, ma'am.
Welcome.
Hello po, ma'am.
Okay, so you have the week to do it. So, ang deadline natin next week pa.
Next.
Yes?
Ma'am,
Okay.
ano po, yung sa program po, kailangan po ba yung 3 tao magkakapareha sila nung kinuha program? Kung
Hindi.
po yung 3
No.
sa TV, o pwede pong iba-iba?
Pwedeng iba-iba.
Sige po, ma'am. Thank you po.
Yan. Para ma-assess natin sa community natin yung mga health nila, yung kung paano yung mga health services, no? Okay, any more questions?
Po,
Okay, go.
yung salo po, yung RA, ilan po papasa yun? Yung deadline po nun?
Oo, so actually I'm
Sabi niyo po
adjusting
yung
that. Oo, adjust ko siya next week. Okay, adjust ko yung passing kasi nag-reshuffle eh. So, magbigay pa ako ng 1 week for that. 1 more week.
Eh, ma'am, yung quiz po kanina, pwede pa po ba humabol?
Oh, ongoing naman yon dear. Hanggang ngayon.
Ma'am, di po namin makita mo.
Hindi nyo ma-open?
Yes, ma'am. Kailangan po ng request.
Approval niyo po.
Approval niyo
Sige.
po.
Let me just
Okay,
open
okay,
that
okay
for
po.
you.
Ma'am,
Yes?
yung sa ano po ba interview, hindi po pwedeng conversation lang. Sa messenger.
Oh, no. Mag-picture na lang kayo. Basta may picture. Para
Video call.
sure. Pwede ring video call. Pwede ring messenger video call. Pwede mga mag-video call sa messenger, di ba? Section B. Hindi nyo ma-open. Why? Let me just... Sorry, section B, right? Doon kayo nag-exam?
Yes, ma'am.
Okay.
Yes po.
Let me go there. Kaya pala wala pang nagtitake. 0 turned in. Okay, for a while. Okay, so this is what I want you to do. You could refresh it and then take it. Okay, so that's it for our class. Do you have any more questions? Class? Question?
Ma'am, kailan po basa ng quiz, ma'am?
Basa ng quiz? Ngayon din.
Ngayon din po.
Yes. You have only until 7 p.m.
Okay.
Take the quiz. Okay, that's all. Bye, class.
Bye po, ma'am.
Thank you.
Bye-bye po. Thank you po.
Bye, ma'am.
I hope you learned something.
Bye, ma'am.